Okay, so today I'm going to talk about canine hyperadrenocorticism. Canine hyperadrenocorticism, also known as Cushing's syndrome, is an endocrine disease that causes an elevated circulating cortisol level. As you can imagine, having this excess of cortisol is absolutely not okay for the body, and it is what causes the clinical signs we see in our dogs. The canine hyperadrenocorticism may be a pituitary-dependent hyperadrenocorticism that is the most common form, present in 80 to 85% of our dogs, and is caused by a pituitary tumor, usually benign. The pituitary gland, or hypophysis, is the small pea-sized gland of our dog's brain, part of the endocrine system, and is responsible for producing and releasing several different hormones. On the other hand, Cushing's can also be caused in 15 to 20% of the cases by a benign or malignant adrenal gland tumor. The adrenal glands are these small organs located close to the kidney that produce several substances, including cortisol. There's this last type of disease that is an iatrogenic hyperadrenocorticism, which means that is caused by us, vets. In this case, the disease develops because of long-term or in many cases high doses of corticosteroids to manage a variety of other diseases as neoplastic or inflammatory diseases. In those cases, we discontinue the medication gradually, and usually the dog returns to normal. Cushing occurs mainly in middle-aged to older dogs with a mean age of 11 years. There is no evident breed predisposition. Sex predilection is also not certain, but some authors refer a female predisposition. The clinical signs our dogs show are due to an excess of cortisol in the body. It is as if he is continuously taking high doses of cortisone for a long time. In the beginning, the signs may be mild, but as the disease progresses, the signs become more and more severe. So let's see some of these signs. So we may have a dog with an increased urination and thirst, also known as polyuria and polydipsia. And this sign is by far the most common sign, present in 90% of dogs with this disease. The owner might report that their dog is drinking more, peeing more, that a trained dog might have started peeing inside the house, and this is due to an increased filtration at the kidney and also reduction of water absorption at the same site, leading to more water exiting the body. We may also have a dog with polyphagia, so an increased appetite. Usually the owner has a dog that is stealing food and also begging for food continuously. Pot belly. Pot belly can reflect an actual weight gain due to an increased appetite, or it can be an apparent weight gain because of abdominal muscle weakness, which leads to distension of the belly, also because of hepatomegaly, and also because of an increased abdominal fat stores. We may see a dog with panting because of respiratory muscle weakness, also because of pulmonary hypertension or effect of the cortisol on the respiratory center. We may have a dog with muscle weakness because of the catabolic effect of the cortisol. In severe cases, we may see a dog that is incapable of rising and standing. Hair loss because of the atrophy of their follicles. Some dogs have severe alopecia with only hair remaining in the head and paws. Calcinosis cutis is an uncommon feature, but very characteristic of this disease. These plaques on the skin appear due to calcium deposition, usually in the head, neck, abdomen, dorsal midline, inguinal areas, etc. And yeah, these were some of the signs and also an introduction on this disease. And thank you for your attention. If you have any questions, please leave a comment below and I'll answer them as soon as possible. Thank you.